Hi, Professor Gutgold. Are you familiar with what a TBI is? Well, a TBI, or traumatic brain injury, is a form of acquired brain injury that occurs when a sudden trauma causes damage to the brain. Depending on the severity of the TBI, there are different symptoms that can occur. This topic is relevant to me because my mom and I were actually in a car accident in 1998 when I was only 5 years old, and we both had traumatic brain injuries. So this is really close to home to me, and we both almost passed away from it. Some major causes of TBIs are 35.2% are false, 17.3% have something to do with vehicles and traffic, 10% is assault, 16.5% is struck by something or struck against something, and 21% is unknown or other. And approximately half of all severely head-injured patients will need surgery to remove or repair hematomas or ruptured blood vessels, or contusions, which is bruised brain tissue. Some symptoms of mild TBIs include, but are not limited to, headache, dizziness, blurred vision, mood changes, and memory, thinking, concentration, and attention changes. These symptoms can mean that a person has a mild traumatic brain injury and should go to the emergency room for assessment from a professional. And people with severe TBIs can show the same symptoms but have seizures, dilation of the pupils, numbness, slurred speech, and loss of coordination. Children aged 0 to 4, older adolescents aged 15 to 19, and adults 65 years and older are most likely to sustain a TBI. Adults 75 years and older have the highest rates of traumatic brain injury-related hospitalization and deaths. And in every age group, TBIs are higher for males than females. One way for emergency personnel to determine the severity of a brain injury is by using an assessment called the Glasgow Coma Scale. It is based on 3 sections that, when added together, give a score which determines how bad the brain injury is. The scale comprises an eye test, verbal response test, and motor responses. And I was at a 1 in all categories, so that means no eye movement, motor skills, or verbal communication. Some other tests that are used are imaging tests, such as a CT scan, which uses a scene of X-rays to create a detailed view of the brain, and an MRI, which uses powerful radio waves and magnets to create a detailed view of the brain. Some complications can occur immediately or soon after a TBI. Severe injuries increase the risk of a greater number of complications of more severe complications, such as altered consciousness, a coma, a vegetative state, minimally conscious state, a locked-in syndrome, which means not being able to speak or move while you're awake, seizures, fluid buildup, infections, nerve damage, cognitive problems such as memory and communication. Some types of aftercare can be used to help people get over the fact that they just had a brain injury and have them help out at home. There are complications, and they affect what kind of aftercare is necessary. And some aftercare options are a supported living home group, supported living apartment, home with family assistance, or going to a nursing home facility. And when my mom and I were in the car accident and we came home, we couldn't do anything by ourselves. So we had the home assistance option where somebody would come in and help us every day, cook our food and make sure we could get in the shower okay and get to the bathroom and do simple things that everyday people do and take for granted. There are a few ways to prevent a traumatic brain injury. You could wear a seatbelt when you're in the car, never drive while under the influence, and by wearing a helmet while riding a bike, a motorcycle, a horse, or any other object where you're moving and there's a chance that you can fall off and hit your head. Some statistics from the National TBI Association are each year an estimated 1.7 million people sustain a TBI annually. TBIs are contributed factors to 1/3 of all injury-related deaths in the United States, and that's a 30.5% of all injuries. And about 75% of TBIs that occur each year are concussions or other forms of mild TBIs. So the next time you think about driving without a seatbelt, driving under the influence, speeding, or anything else, remember the effects of a traumatic brain injury. And now that you know about this topic, make a smart decision before you can't make one at all. Thank you.